Welcome everyone. We're going to talk about trigger points today on Pathways to Wellness. It's one of my favorite massage techniques to give to my clients, and there's a lot of great information about what trigger points can do and for your health and your wellness. So with that, my technique is actually a hybrid technique. Remember, I've been doing massage for about 20 years, so I've actually taken neuromuscular, which follows the nerve path, finding the origin and insertion of the points of the tight muscles, and Jin Shin Do, which is an energetic path, finding the acupressure release points, holding them until the tension releases. So with my technique, I'm always finding that muscle knot, that tension, and then I find the beginning and the end of that pressure. I apply it until that knot releases. I hold it for a few seconds. There's also a counterbalance point sometimes that I use, as you can see in the picture, where there's a hand on each place. So with that, I really enjoy the trigger point massages. It really gets into those muscles, and I'm going to have a couple guests here today. They're going to tell me what's going on with them. So why have the trigger point massage? It alleviates painful muscle knots and restrictions. It's less intense than a deep tissue. It's a little bit of gentler approach, and it unwinds and releases those adhere muscle fibers, a lot of layers. If you go deep really quickly, sometimes it nullifies. It gets in there, and the fight and the flight becomes so intense that this whole trigger point will nullify that procedure. It'll help get the releases. And then the common areas are usually neck, shoulders, arms, legs, and glutes. So, look, you have to be careful with trigger point releases. There are going to be, there you go. So the contraindications. If you have an acute injury, so new injuries, like if you've been in a car accident or if you've had some kind of sporting injury, you just need some time to heal. Surgery, you're going to wait 6 weeks, and you usually need a doctor's release. Osteoporosis, common sense, the elderly, they have frail bones and skin. Broken bones, another one, like if you've been in a serious accident. And then, of course, if you're not feeling well that day, you have some kind of flu, fever, cold. Of course, now we have COVID. Stuff like that spreads easily. So anyway, with the trigger points, it's just a great way to get to some of those other deeper issues that you have as a client, as a viewer out there. But what we're going to do is we're going to take a quick break, and we're going to get some real life demos coming on. So I'll see you in a few minutes. Thank you. Welcome back, everyone, to Pathways to Wellness, and this is Tim Maloney, right?
Yes. Yes.
Good, I got that right.
You got it right.
All right. So anyway, he's gonna be my body here to do trigger point releases, and so just tell me a little bit what's going on with you and what we're gonna focus on today.
So I've been having some shoulder pain for quite a while,
Okay.
and I think I did something last fall. That it just kept getting progressively worse. So I had an MRI done.
Okay.
And here I have 2 torn rotator cuffs.
Oh wow.
Yeah.
Jeez.
Fun.
Okay.
Fun, everybody.
All right.
I don't recommend it at home. So I got something called plasma-rich platelets
Okay.
injected into my shoulder.
Wow.
And that was about 6 weeks ago, and I've been going to PT. But there's been a couple definite trigger points, like near, what do you call this bone right here?
The scapula.
The scapula, thank you.
The shoulder blade.
I'm a dirt doctor, but I'm not a real doctor, so I don't know the name of body parts. So I've had that pain, and so this is a good opportunity for you to do the trigger point massage. It's perfect.
Yeah, this is great. He's come to me in the past for a few massages, and so I thought of Tim. So let's get started. We're going to go ahead and start him face down, because with trigger points, first of all, I got to make sure that top layers of fascia is released, okay? So like we just did, we reviewed his health concerns, asked for the sources of pain, and then determining the goal, we're going to actually try to make sure he feels a little bit better. All right, so go ahead and lay face down.
Okay.
Climb on up. I told him I'm not going to make him get naked, so anyway, underneath, there you go. Always put this bolster underneath, because that helps with the ankles to give it the right bend and elevation and take the pressure off the low back. So, and you said it was this left side over here? So with my hands, I'm just kind of just doing some nice gentle strokes down, and I can feel that this side, this left side near his shoulder blade is a little bit tighter. So I'm just going to go in here and first just kind of relax his muscles, do some nice technique of effleurage, maybe a little cross friction. And then what I'm going to do is, I feel like it's kind of tight right in here. Am I near it? He said, mm-hmm. He's not mic'd up. So what I'm going to do is I'm just going to hold in there. I kind of feel the beginning and the end here. Remember I said it's like feeling, I'm not actually going to the insertion and the origin of the muscle. I'm just kind of going where the tightness is. And then when I feel it, I'm just going to push in a little bit of pressure. There you go. And sometimes you'll just feel the body relax. So it might just kind of feel like this, kind of relax, right? Or maybe I'll feel some heat come off his body, maybe some tingling I might feel in my hands from his body. So that's how you kind of know when a trigger point is starting to release. Now I also feel it going down a little bit further down his back, and whether it's just because I released some of this for him, it's now migrating or moving down his lower back on that erector spinae muscle. There you go. And then of course I feel it tight up here, which would be his upper traps, the levator scapula area. Trying to remember my anatomy here. What caused your shoulder injury? Do you know?
No.
No, okay.
Nothing specific, I don't think.
Sometimes, as we get older, we become more golden in our age. Sometimes just our body muscles, parts just get worn out. All right, so that was just a quick tease for him. All right, now you're gonna get up nice and slow, and I'm gonna have him lay on his back. So he'll rotate around. There you go. His knees are up. Again, we put this underneath the knees, again, to help with that, release that pressure on his low back. So this works out perfect for my filming because his left shoulder is what's bothering him. So again, I'm going to go underneath, kind of like right in here. Is that a kind of a good spot? Mm-hmm. I don't know if you see him shaking his head, yes. So what I'm feeling, so this is what's really cool, when you're laying on your back and I'm going to those muscles underneath, what's happening is gravity brings naturally the muscles off your bones. So I can get in a little bit deeper without being super aggressive. Remember I was trying to explain to you earlier the fight and flight? The fight is like if you go real intense, the muscles tense up and they fight. And the flight, then sometimes that root of that cause kind of hides from you. But if you can go gingerly or go like a layer at a time and put different trigger point releases in there, then it's going to release in a natural way. Now, you can't see exactly what I'm doing, but what I felt was the beginning and the end of that tightness, kind of right around the scapula, and then what I did is I kind of pulled into it and I pushed it up a little bit. But I was able to get a little bit deeper than when he was face down because now his muscles are just naturally coming off the body. And then again, I just feel his muscles relax. Sometimes you might hear him sigh or the person on the table sigh. You might just see a visual relaxation in the body. I'm going up into his neck muscle now because I can feel it tight up in here too. And I'm gonna do a couple more trigger points. So one's going right here and one's going right there. So one's closer up to his neck and one's closer down here to his scapula, the top of his scapula. Rotator cuff injury is one of the more common injuries we have in our society. People are just so active, and we use a lot of, I guess, a lot of repetitive motion and a lot of lifting. And Tim and I were just saying, when you're younger, you know, a couple years younger, our bodies heal faster, we're more flexible. As we start to age a little bit, the fluidity in our muscle structure slows down. So what I also want to do is so that his other shoulder doesn't get upset, because we only worked on the one shoulder, I'm just going to do a couple trigger points, relaxing here so he's balanced.
Can't have it being jealous.
No, you can't have it being jealous, and you can't have walking around with one arm all nice and relaxed, and the other one up into your shoulder, you know, up in your ears. This is one of my favorite techniques to help people with, or at least maybe that's the majority of people that come to see me, because our society, we tend to be a lot doing desk work, or we tend to be more up in our mind with stress and our to-do list and family and work matters, and we just carry a lot in this upper shoulder, and so there's usually a lot of trigger points that can be done. And then I'm just going to balance him a little bit here at the top. I heard his sigh. It was small.
I did.
There you go. Okay. And then when I get done, I just kind of ground him a little bit, make sure he's okay. I mean, normally this session would be 30 minutes at least to maybe an hour. All right, you're going to get up nice and slow. There you go.
Okay.
And you're going to... Cool.
Okay.
So how do you feel, Mr. Tim?
Like I want to go another 30 minutes.
That was a tease. That was 5 minutes, right?
Yeah, but I mean, I definitely, even that little bit, it feels a little more relaxed, I guess, is a good way to put it.
Yeah. I mean, that's kind of the... Go ahead.
Yeah. So it's different with an injury too, versus just someone who's holding tension.
Yeah.
So this has been like, I'm going on a month of PT, and I think I'm going to mix some more massaging with this, because it seems like a good fit to do both. Yeah.
Yeah, I think what I've noticed in the past, because at one point in time I worked with a chiropractor, and then also there was a physical therapist. They all have their specialty, right? You know, the chiropractors are making the alignment, the PT is making sure you get that movement and some of the stretching in, and then and the massage therapist can go in there and get more of the fibers, the muscle fibers, and they can kind of see that whole part of the body too, versus just a specific area. So.
Yeah.
Cool.
Well, thank you, Joan.
Thank you.
Okay.
Thanks for coming and being
Yeah.
on Pathways to Wellness. We're going to take a quick break, and we're going to have our next body up. And her name's Rachel, so we'll be back in a few minutes. Thank you. Welcome back, everyone, to Pathways to Wellness, and I have my next body here, Rachel Bailey. Thank you for coming today.
My pleasure.
Yeah, and she's a brand new person here to Pittsburgh, so also welcome her into our Pittsburgh community. So tell me what's going on with you today as we do the trigger points.
So I have some pelvic misalignment
Okay.
that a couple years ago resulted in like a really severe muscle spasm in my back.
Okay.
It mainly comes from my left hip being kind of rotated back and upshifted or upslipped a little bit, I think.
Okay.
I mostly get like a achy kind of fatigue along my lower back here,
Yeah.
along the top of my pelvis
Okay.
and around to the side, and then also some sore tenderness kind of here in the front of my hip.
Was there any injury that caused that, or?
There was actually. I was a waitress for
Wow.
about a year
Yeah.
after COVID, and of course we were understaffed, and
Yeah.
everybody wanted to come out to eat
Yeah.
because the world was back, and so I just walked really hard, quite a lot, with my leg kind of turned out like this because this was my carrying side.
Wow.
So I was bearing a lot of weight over here,
Yeah.
and had this external rotation, and over time it just kind of twisted everything
Wow.
out of joint.
So there's a real life example of you just doing your job, it got really busy for her because of the situation, and then it impacted her whole body. And the other thing I'd like to say, Rachel just got done with massage school not too long ago, right?
Yes, I did. Yes, I moved to Pittsburgh to become a massage therapist.
So she knows a little bit more about the language and the understanding of how all the different muscles work. And it's a good review for me because I've been out for almost 20 years now. But I appreciate you coming today. So what we're going to do is we're going to start her face down again, like what we did with Tim. So go ahead and get on the table. And again, I'll put this underneath her ankles to help with that. Is that in the right spot, or? Okay. And you said it was on this side?
Yes, ma'am.
Okay. So I'm just going to relax her back a little bit. Remember, it's just trying to get all those muscles to relax. And both sides of her glutes. The interesting thing about our glutes, it's got about 20 muscles in there. So just with her actual repetitive motion of being a waitress and carrying a lot of weight, could impact any of those muscle groups. Now what I'm going to do so the viewers could see a little bit better is I want you to side lie. So you got it. And are you comfortable this way? Do you need?
Adjust my.
Let me get sorry guys, I'm leaving the camera here for a second. But I'm going to put this underneath her head. So that's going to be, is that a little bit better?
Oh, yes, that's great.
So that was just a towel. I didn't think about that when we were setting up. So is this the area where it's?
You're right on the place where I feel it the most.
All right, and so it's interesting how the body just kind of says, come here, but I can also feel it, that this area is super, super tight around her pelvis. And so what I'm gonna do is I'm gonna put one trigger point here and one down here, and there's some called counterbalancing also. And so what I'm trying to do is get both of them to work off of each other, both points. And I feel it going up a little bit into here, which makes sense if she was carrying the tray. She also told me she started working this past weekend doing some massages at her new place of employment, and she has a lot of tension in her upper body and her arms from all the massage work she did. So I feel another trigger point like right in here. Again, I'm just kind of going, I'm feeling around until I get kind of that, what I feel the sweet spot. It's almost like a little knot in there, a little piece of sand or a little small piece of corn or something. I'm used in the Midwest. My husband kids around with me in my corn. There you go. So I'm holding into it, and I'm just, what I'm feeling is as it releases some, what it's doing is coming out like that, like the muscle tissues, the fibers. There you go. Now I'm going up a little more high on her hip area and getting into some of that glutes attachments. Again, I'm holding into that area. Sometimes you may hear me breathe out a little bit, and that's just allowing her tension to pass out of me so I don't take it into her tension into me. And I heard her breathe a little bit, letting her breath works. So I feel another strand going this way. So what I'm gonna do, she shook her head yes, so I'm gonna put one here and one up in here. There it goes. I'm gonna go a little bit down her leg, is that okay? The other piece of information she told me off screen is that unfortunately she's got a bruise right about in this area, and so I'm trying to be careful not to do trigger points in that area because that could be painful. There we go. Nice. You just never know how long and how far it's going to go. Her calf feels pretty good. Her ankle feels pretty good. Her foot feels pretty good. Maybe a little bit in her quads up here on the top of her knee. So I feel a little bit down there. So I'm going to put one up here in the hip and one down here by her knee. So I'm just going to lift up your knee a little bit. So kind of right down in this area. Where my thumb is where I'm feeling it. There it goes. All right, so now what we're gonna do is we're gonna have her lay on her back, looking up. There you go, perfect. You okay?
Oh yeah.
Do you want that underneath your neck or no?
Actually, yeah, that feels great.
There you go, see? So we don't need this. I'm going to take this out so I can get a little bit closer to her. Well, I guess if I was doing her neck massage, but I'm not. All right, so let me get back focused. This side is where it hurts? Okay. So she also said it was going in around the front, into the front of her pelvis, into the what we typically call the hip. So I'm going into this area now. I feel tightness right there. Is that okay?
Oh yeah.
Sometimes people are ticklish. Are you ticklish here?
Sometimes, but your quality of touch is great.
Okay. So I just ask that when I have people on the table. Ooh, there you go. So that released pretty quickly, at least that one group of fibers. So I'm going a little bit deeper, doing another group of fibers. There you go. Is that spot okay? I like to check in with the person on the table too, because again, it's that fight and flight. If they're fighting it, then the root cause of it's going to like hide from you. It's gonna fly away. So that nullifying effect helps it have a more effective and lasting release. At least what I've found with a lot of my clients over the years. Right here, is that okay?
Yes, ma'am.
So now I'm down by her knee again another counterbalancing point. We're trying to get those muscles to go back to the neutral and balanced state. And what does that mean? It just means whatever alignment it really needs to be in for your body, at least at this moment in time, unwind it and get it back so it's more functional for the body. There's a lot of different techniques out there, and they're all great. Like I said, I kind of made this one up over time. It's a hybrid of a couple other techniques I've used. She just had another nice release. Not only in her muscles, but I also felt her breath. All right, I feel like I could work on you a little bit longer. All right.
There's plenty to do in there.
So another way to ground, because I was working up at Tim's head, was his head and shoulders. Now I'm just gonna do down by her feet and just ground her. And that just brings her back into her body. So now you're just gonna get up nice and slow. There you go.
Wow. That's remarkable.
Isn't that cool? I mean,
Yeah.
that was what, 5 minutes or something, just trying to find, and all it was, she told me verbally what was going on with her. And then I just used my hands to feel those muscle tightness, and then you just hold and release. Like Jinshin Do, you would hold into different, like acupuncture, if you've ever seen a chart, there's all these different meridians and these points where you can put the needles in. Acupressure goes along with that, and you put those points in. But I said, why not do that along with neuromuscular and just concentrate where I feel that energetic nerve path, muscle tightness, hold into it, and then let it go, and then hold into it and let it go, and wherever it is. And then sometimes I need another counterbalancing to make sure that all flows together.
Well, I loved your work. I feel so much more ease just across my whole midsection, and a lot more balance in my weight distribution between both of my legs.
There you go.
Yeah, thank you so much.
Thank you. All right, we're gonna take another short break here, and then we'll come back for a little summary and review with the guest. So we'll be back in a few minutes. Thank you. Welcome back, everyone, to Pathways to Wellness, and thank you to my guests here. We have Tim and Bailey here. We're going to do a quick summary of what we did, what we talked about today with the trigger points. As you know, it was a hybrid technique that I've used between neuromuscular and Jinshin Do. It's a little less abrasive, meets the muscular needs for unwinding and releasing the tension. Nullifies the fight and flight syndrome, so you bring it into more of a balance. And you want to avoid it if you have acute injuries, surgery, broken bones, elderly patients, and if you have anything going on that you're sick, contagious. Okay? So again, I want to talk to Tim a little bit. I mean, you've used massage most of your life, and also with your business with Dirt Doctors. Tell me a little bit about that and how your staff.
I don't know about most of my life, but maybe since adult.
Yeah, okay,
Yeah.
there you go.
So yeah, I own a cleaning business, and it's very physical, and so I've taken advantage of massages because of that personally. But recently, with Joan, in the last few years, I guess you
Yeah.
could say, I've sent some employees your way,
Yeah.
team members. We call them team members.
Yeah.
And I know you specifically worked on Dana more recently, and I think I think in our industry, you're just a lot of bending, repetitive motion. It beats up your body, and massage is a great way to not only heal your body, but it feels good too, obviously.
Well, and if you've got any of those knots or trigger points or stressors in your body, but also you guys work at night, I'm assuming, most of the time.
A lot of times, yeah.
So emotionally, it's going to be hard for to stay in that rhythm at night. I guess I was going to say kids, but your staff, your
Yeah.
team members are going to need some of that extra time to relax too, because their sleep cycle's off. So I would think over time.
It depends. A lot of people don't work that late at night, but it is like a later shift. You're correct.
Oh, okay.
So, yeah.
So they're not
But-
working at 2 or 3 in the morning.
No, not normally.
Oh, you're
I
a
don't-
good boss.
I'm a nice boss. I don't make people work after midnight.
There you go.
That's our goal. So, anyways, yeah. So it's been great having Joan to step in and provide that for our team members.
Cool.
So, yeah.
All right. And then Bailey, actually,
Rachel.
Rachel. Oh my
Bailey,
God.
Bailey is my last name.
I was like, oh no, what's her first name?
That's okay.
I massaged with her cousin Greer, so I was like, no, it's not Greer, okay? So anyway, so Rachel, welcome to Pittsburgh.
Thank you.
And you said you just recently took this path of massage to be a practitioner. So tell us a little bit about that and how you're.
Well, yeah, I mean, I've always loved working on my feet. I've waited tables. I was a teacher for a short amount of time, and I hurt myself a lot, especially as a waitress. And massage has helped me recover from a couple of major injuries, including the one that I mentioned earlier, which had me out of work for like 9 months.
Oh, wow.
It wasn't until I started getting massage that I started being able to come back. And also, I lost my sense of smell when I hit my head in 2014, and I received craniosacral therapy, and
Wow.
it like came back while I was receiving the therapy.
Wow.
So I'm a big believer in the healing arts, and I'm very happy now to be a practitioner.
Cool. And you're starting your own business too.
I am. I'm in the early stages of setting things up for Metta Massage, which will be in Shadyside. I do take clients on Sundays and Mondays, and you can find me on Instagram at Metta with 2 T's Massage PGH. And I'm also at Center Ave Massage and Spa several days a week, which has just been a wonderful, warm, welcoming workplace to get my feet wet in my new community. So I look forward to serving the Pittsburgh public soon.
Good, good. Well, welcome to Pittsburgh, and thank you, Tim, for being here today, and you both being my bodies and having actual real situations that we were able to address in just a few moments. So with that, I want to thank everyone for being here today, whatever pathway you are to wellness. And as you know, I try to do these monthly, so we will have another show or two here shortly. I think the next one will be conscientious eating with one of my underwriters, Pure Grub, and then I'm going to be also doing pregnancy massage this next month. So with that, thank you viewers, and I will see you next time.